Health risks of smoking go beyond lung cancer. Doctors ask patients about smoking habits for the same reason they check weight, blood pressure, breathing, and heartbeat during a visit. The answers, much like the results of the other checks, provide information that offers clues to overall health and risk factors. They can also guide treatment of existing health conditions. Doctors are there to improve your health, and cigarette smoking is probably the single most harmful thing you can do to your health, said Jonathan Folds, professor of public health sciences and psychiatry at Penn State College of Medicine. It's hard to find a part of the body not affected by it. While most patients know that smoking causes breathing problems and lung cancer, they may not be aware of the magnitude of the risk or the other health problems it can cause. If you smoke a pack a day or more, your risk of getting lung cancer isn't just 1.5 or double that of a smoker, explained Folds. It's 20 times as great. Dr. Alexis Reedy Cooper, a family medicine physician at Penn State Health Milton S. Hershey Medical Center, said smokers may not connect smoking to cardiovascular problems such as heart attacks and strokes, or other diseases such as type 2 diabetes and cancer. You should let your dentist know if you smoke, because he or she can take special care to evaluate you for tongue, head, and neck cancer, she said. Dentists are often the first to detect those. Smoking is also dangerous for people who spend time with a smoker. Children who live in households with a smoker have an increased risk of developing asthma, ear infections, and lung infections. Pregnant women who smoke put their unborn child at risk for complications and premature delivery. Folds said quitting smoking has a bigger effect on reducing risk for a heart attack than lowering high cholesterol or blood pressure, so patients should expect their doctor to assess their smoking and advise on smoking cessation medicines just as they would prescribe medicines for hypertension or hypercholesterolemia. Most patients expect doctors to ask about smoking, even if their answer hasn't changed from the previous visit. It's an addiction and tough to quit, but patients have more respect for the doctor when he or she asks about it and offers to help them quit, Folds said. He encourages providers to talk about the subject in a positive way, outlining the health benefits, and look for ways to help a patient quit, whether it be counseling, medication, or both. It's not a question of whether they should quit. It is critical that they quit, he said. Smoking is a risk factor, so many things that it doesn't make sense to wait. Reedy Cooper said new guidelines also recommend that smokers get more frequent lung cancer screenings, so it's important for patients to be honest about how much and how often they smoke. We're not going to judge you, she said. We just want to help.